Everyone, it's James here. Just wanted to say thank you very much for all of your combined efforts on the community health workers as researchers scoping review. We're making some really good progress on this, but I did notice that we haven't screened all of the articles and that there are a relatively high number of conflicts. So there are about 700 papers where one person has voted yes or no or vice versa, and these have been flagged as conflicts. And 700 for this stage of the review is relatively high, so that would indicate to me that there is some slight confusion around the inclusion or exclusion criteria, which studies should be included or excluded. So I think the first thing to do is I'm going to take you through some of the key points that you might have missed in the onboarding session, and hopefully this will help you. So the first thing to do is know that criteria is in COVIDENCE here, and if you click on this, this will highlight the inclusion and exclusion criteria, and it might be just worth us recapping what the inclusion criteria for this study is. So the inclusion criteria are that community health workers need to be the primary focus of the study. So this should mean that community health workers must deliver all aspects of the intervention under study, or if it's not an intervention study, they are the only subjects under study. So if the study is reporting on community health workers and doctors or nurses or other allied health professionals or patients, then this would not be included. And remember, all article types are eligible for inclusion. If you're not sure on something, it's always best to just click maybe, and that will take it through to a second screen. The other important thing to highlight is that you can turn highlights on. So if you click on show highlights here, this will highlight keywords in green, and I think this will be incredibly useful when it comes to the screening process. Remember, the screening process is designed to be relatively quick and straightforward, so I'm going to take you through my methodology for how I go through things here in about 10 articles, and I'll hopefully resolve a couple of these conflicts here. So the first thing I do is I look at the title and I ask myself the question, does this title jump out to me as a study where community health workers are the primary focus of the study? If the answer is yes, then I'll take a good look at the abstract and then I will either include it or exclude it. So let's take a look at this first one. So it's the critical importance of community health workers as first responders to COVID-19 in the USA. Based on this, I would say community health workers are probably the primary focus of this study, given the title. And again, when I read the abstract here, this talks about community health workers being experts in addressing social determinants of health in community-based settings. It also talks about a mixed method study with supervisors and community health workers describe the critical role that community health workers play in the response to COVID-19 as a case example. So I would say this should be included. Now you might notice that some of the abstracts here show no abstract. Now in this case I would read the title and it would say use of community health workers for community-based hypertension screening in urban Haiti. Now until we can get hold of the full text of the study, I would say based on this title here, this study is focused on community health workers being the primary focus of the study. Again, I would click yes. Similarly here, Latino community health workers meeting their community's emotional needs in intuitively culturally appropriate ways. Again, I would say yes. The role of community health workers in the COVID-19 response in the Caribbean, an exploratory study. This title would indicate that this study is primarily focused on the role of community health workers. Again, we don't have a full title or abstract. We don't have a full abstract here, but once we get the full text for the full text screening process, we can take a look at this study in greater detail. So again, I would click yes. Transitioning from sick kid to community health worker, building better bridges to adult care. I'm not so sure about this one, but again, because it does have community health worker in the title, I think it's worth screening the full text of this once we're able to locate it. Let's take a look at this study, which has an abstract attached to it. So this study is WASH Benefits Bangladesh Trial, Management Structure for Achieving High Coverage in an Efficacy Trial. So there's nothing in this title that jumps out to me as community health workers being the primary participants, but when we have highlights turned on, you can see here in the methods, community health workers delivered individual and combined WASH and nutrition interventions to over 4,000 households in geographically matched clusters. So this is indicating that community health workers are delivering the full intervention. And local community health workers were recruited through transparent selection. If you look at the criteria, here it says that this means community health workers should deliver all aspects of the intervention under study. So I would say that this study here merits a full text review, so I would click yes. Again, these are titles that don't have abstracts, but we've covered how we'd look at these. So let's move on to this one where there is an abstract. So this is supply side and demand side factors influencing uptake of malaria testing services in the community, lessons for scale up, a very cluster randomized community-based trial in Western Kenya. There's nothing in the title here about it specifically being on community health workers, but because it is community-based, then we should take a look at the abstract. And as you can see, again, community health workers have been highlighted multiple times in green, so this is also a strong indicator this study could be about community health workers. And if we look at the design of this, you can see here they collected monthly testing data from 244 participating community health workers and semi-structured interviews with a random sample of 70 community health workers. So again, this is primarily focused on community health workers being the primary participants in the study. So I would say that for this study, and I have read this abstract in full, I would say that this should be included. I hope that that's given you a useful overview of how I go about screening things, and just worth flagging that this criteria are here to help you. If you're not sure on something, you can always click maybe, but it's worth first of all looking at the title, asking yourself the question, does that title really highlight that this study could primarily be about community health workers, or they are the primary focus of the study? Then once you've read the title, going through the abstract, and using the highlights feature. I hope that helps. I understand that this isn't especially a clear-cut review, and it is challenging, so I appreciate there are challenges. And if you do have any questions, concerns, or you want anything to be clarified, please do get in touch. I'm more than happy to run through this with you individually. We can sit down for 20 minutes, half an hour, and work through a couple of them together. And hopefully that will give you a little bit more confidence moving forward. Once again, thank you for your efforts on this. Really looking forward to getting this first round of screening wrapped up and moving forward with the project as a whole. Thank you.